think we can start at this point. It's 11 CET sharp. Good morning, everybody, ladies and gentlemen, and welcome to this joint event organized by projects funded by different programs, the H2020 SmartWork and the Interreg Europe EU Chafet. I am Natalia Allegretti, Senior Project Manager at the ECH Alliance, and I am Communication and Dissemination Manager for the EU Chafet project. Aim of this event is to outline the responses given by the two projects to the EU public consultation on Green Paper on Aging, and to identify solutions that can bridge the gap between technological progress and real users' needs and expectations. As Carolina has already remembered, you can actively participate to the debate using the Q&R window chat box, and all the speakers will try to give feedback in writing during the webinar. The workshop is divided in two main sessions. The first one, more political oriented, will be coordinated or moderated by myself, while the second one, which will be more interactive, will be moderated by Karolina Makiewicz, ECH Alliance International Project Director. Let's now open the working day with the first part of the workshop that will shed light on the European policy framework addressing the active and healthy aging area of intervention. It's my pleasure to present our first host, Bruno Ribeiro Barata, Counselor for Social Policy at the Portuguese Permanent Representation to the European Union, representing here the European Union Portuguese Presidency, which is ongoing until the end of this month, until the end of June. Bruno will inform us about the Council conclusions, which represent the results of this period of presidency. Bruno, the floor is yours. Thanks.
Hello, good morning. I don't know if you pretend okay. Yes, my video, it's okay. Thanks a lot for the invitation. I'm delighted to participate in this panel, and of course, congratulations to you to put these topics on the political agenda. I pretend I like the priorities of the Portuguese presidency in the field of social policies, of course, with particular regard to the rights of older people. The presidency acknowledged since day one that it has never been more important to place the European social model at the heart of the European agenda. We believe that the European Pillar of Social Rights responds to the social dimension of the crisis and adequate way to strengthen Europe's ability to keep pace with climate, digital, and demographic change. We accepted the challenge of strengthening Europe's resilience and confidence in the social model, promoting a union based on the shared values of solidarity, convergence, and cohesion, capable, of course, of acting in a coordinating way and recovering from the crisis. COVID-19 represents one of the biggest challenges Europe has ever faced. That is why building a fairer and social Europe should be based on placing the European Pillar of Social Rights at the core of the European recovery. And we are working on that and put this social agenda on the top of the political agenda. The present moment is decisive for our country's future and for, of course, the future of the European Union. We have the responsibility to show our citizens, our workers, our families, and our companies that they are not alone, that they are at the center of our measures. It's like say the motto of the Portuguese presidency is time to deliver. It's time to all citizens have the feelings, and we are working to improve the well-being of all. Regarding the rights of the older people have been one of the priorities of the current trio. Last September, Germany adopted Council conclusions on human rights, participation and well-being of older persons in the era of digitalization. They focus on the impact on human rights when shaping national strategies and exit strategies from the pandemic, and the EU Green Paper on Aging, involving older people in decisions-making process, affecting their lives and strengthening intergenerational bonds to challenge stereotypes and prejudices against both younger and older people. The Portuguese presidency of the Council took up the torch, aware of the disproportional impact of the pandemic on older people. We decided to bring these collective rights to the political limelight. I'm happy to remind you that we successfully adopt Council conclusions on the mainstreaming of aging back in March. The conclusions invite member states to develop a national strategic framework for mainstreaming aging and other initiatives that enable older people across the Union to enjoy their fundamental rights and reach their full potential. They call to improve access to and quality health care and long-term care, including developing and ensuring access to services that provide older person-centered and integrated care and foster integration between health and social services. Also, they call for joint work towards implementing the European Pillar of Social Rights, principles for people of all ages, particularly those related to the rights, access to quality health and long-term care services, old age income and pensions, gender equality, the inclusion of persons with disabilities, and equal opportunities. They call for recognize for the need for improvement in investments in long-term care, supporting measures advised in the Council conclusions on women rights, participation and well-being of older persons in the era of digitalization. The Portuguese presidency made it one of its priorities to close the gaps in the protection for older people's rights and take stock of and pursue measures to tackle the impact of COVID-19 pandemic on older people, notably in long-term care sector. The conclusions stress the need for an approach that recognizes older age as part of a wider life course by looking at the impact of the EU policies on different age groups, age mainstreaming, and in intersection with other grounds of discrimination. All in all, we believe that Council conclusions on mainstreaming of aging will contribute to ensuring the experience of aging in the core union values of equality and diversity, and will be indispensable for ensuring proper coordination of aging issues from the local to the European level. The Portuguese presidency set out its motto, "Time to deliver, a fair, green and digital recovery." I truly believe we did regarding aging and the rights of older peoples. Thank you for the invitation. Thank you for your attention. I wish you a good day of work. Thank you.
Bruno, thank you very much, and thank you also for the great results achieved by the current presidency. The message I would like to take home is to push the development or national strategic framework to enable the older population to really enjoy and fully exercise their social and, more important, human rights all over Europe, and I would say all over the world. So thank you again for your contribution. And now we are very pleased to welcome Irina Calderon-Ribal, Policy Officer at the European Commission, DG Connect, Health, Wellbeing and Aging, that will shed light on the Green Paper on Aging, released by the European Commission at the beginning of this year and open for the public consultation until April 2021. Irina, please, it's your turn. Thank you.
Good morning. Just a moment. Good morning, and thank you for the invitation today. Can you see my screen?
Yes, Irina, but we cannot see you. So if you can switch on also your camera, it would be great.
Yes, of course. Thank you. Yes.
Perfect.
Good morning,
thank you.
everybody. And thank you for the invitation. I think that nevertheless, my slides are not in full screen. So I hope now this is fixed. Okay. Good morning, and thanks a lot for the invitation. In fact, as you said, I'm a policy officer in a unit which has aging at the end. So we have been working a lot. I would say more than half of our work has been to support innovation for older people, both with many different projects, but also with different programs and different partnerships, such as the Active and Assisted Living Program or the European Innovation Partnership on Active and Healthy Aging. So we have been working together with colleagues from other services in the Commission in the last year and even longer on various initiatives to support demographic change and to support older people also in the era of digitalization. And this has been a very fruitful inter-service collaboration to issue different initiatives and policies. On the Green Paper, which was published in January this year, and there was an open consultation until the 21st of April. we worked for many months trying to make it inclusive for the different challenges that aging poses to society, whether those are health related, whether those are related to pension or to discrimination and other issues. We have put up front a life cycle approach to aging, meaning that it is important that age is not referred to as something that happens to those people. It happens to all of us, and it starts very early, integrated part of our life as human beings. So the need is to live our life actively and in a qualitative way, and when it comes to health and digital health in particular, to learn from as early on as possible also how to support healthy lifestyles through our lives. So the Green Paper proposes to look at the different needs in 4 different stages, from a very young age into working age, then to retirement, and the different sometimes new opportunities that it could give to aging people, and also to people who reach 80s or who become more dependent with time with their health issues. I have extracted one particular part from the Green Paper on Aging, which I wanted to highlight today, and it is the people who would potentially be in need for long-term care in the future, jumping by 50% until 2050, which is enormous. And later on, I would mention this as well, but the 2021 Aging Report this year, which I think would be adopted in 2 days, in the ECOFIN conclusions, it states that the dependency for worker and for a retiree would change dramatically until 2070, moving from 2.6 people to 1.7. So these are thoughts that we have to have in mind, and not we, but policymakers across member states when they design policies, social policies, health policies, ICT policies, or even construction policies in the near future. Now, coming to the Green Paper on Aging, and I'm thankful that many of you did submit contribution. We are currently in a design phase of what the follow-up actions would be, but we have received, as you can see, a total of 473 replies, most of them via the online questionnaire, but also, as you can see, quite a lot also via written questionnaire. So this is also, I think, a good sign when it comes to accessibility. Also, you could also see the contribution per country. I would say that the fact that the contribution from Belgium is so high comes from the fact that so many stakeholder organizations are in Brussels and in the area. But still, good to see that there has been a relatively logical distribution of submissions in the EU when it comes to the organizations and the people and the stakeholders that we normally also work with. And here is also a distribution of stakeholder groups, something that we expected, very high participation of non-governmental organizations, and as you can see, of citizens. So this is a very good achievement, I think, that so many citizens have replied to these consultations. We wanted to put together the different replies, and this is an ongoing work. And we have already, let's say, found the 5 main policy areas in which we could expect to take actions and to design those actions in the coming months. Those 5 main policy areas are pensions and sustainability of social protection systems, long-term care and healthcare, also related to digitalization, healthy and active aging, including digital tools and skills, inclusion and non-discrimination, territorial dimension of aging. When we go slightly more into detail, and I would skip the pension part because my competence is more related to digital health and to innovation and aging. There are very interesting contributions that we want to take on board, whether it is to invest in prevention and early diagnosis, to promote health from early on, and of course to address the long-term care sustainability and have health in all policies. This could also very much be related to the content, to the substance of the conclusions that the Portuguese presidency adopted earlier this year. But also the need to promote local solutions, something that is very important when it comes to innovative solutions in particular, and the different mechanisms that we have supported to also promote exchange and learning of best practices from one region to another region in different partnerships and programs. When it comes to digital tools and skills, also, and to promote active aging, again, it comes into promotion of healthy lifestyles from early age and applying this life cycle approach to aging, promoting intergenerational activities, of course, combat ageism, the need to take a holistic approach, to support lifelong learning, and address also the challenges that still remain important, especially in some areas when it comes to connectivity and access. Interesting also contributions came in the area of inclusion and non-discrimination, come to promote inclusive and flexible labor markets, flexible retirement schemes, age-friendly and age-inclusive workplaces. I think very relevant for the next hosts of this webinar. The combating discrimination and in the workplace, and to support the silver economy, of course, also senior entrepreneurship at EU level, volunteer, and overall a human rights-based approach. Lastly, when it comes to the 5th policy area, the territorial dimension of aging, I think that is very clear to everybody that the challenge that rural areas face when it comes to demography are even more important than urban areas. So it would be very important to make sure that relatively sparsely populated areas and relatively more aging areas are given more support when it comes to demographic change. This means also to develop community-based care services or to promote them more strongly, and to promote accessibility in this area's connectivity, as I said before. Again, the need to develop age-friendly communities and to bring the products and innovations that are linked to digitalization. Lastly, also to promote networks and local solutions as well. We could discuss this slightly later. I think that many wanted to know what are the next steps. I wish I had a full list of great projects that I could present to you today, but we are still very much in the design phase, and we are going to publish a staff working document and a synopsis report from this consultation, which is quite big, so we have received a lot of replies, and propose ways forward in this document as well. We, in the coming months, of course, the idea of designing policies is one thing, but also there would be a need to make sure that they are implemented as well in member states, and that are, of course, also discussed with member states at a very high level. Nevertheless, I wanted to mention the upcoming MFF, and when I say upcoming funding programs, this is because unfortunately we are almost half a year in late with the publishing of these programs, and Digital Europe program and Horizon Europe program present specific opportunities for innovation in aging, but in also, of course, in health and in a whole life perspective, different opportunities also for digital skills. Digital Europe program will also have specific calls. It is a slightly different program, building infrastructure and promoting bigger projects than in Horizon Europe, making sure that the research and innovation results that have already been developed would also be deployed also on a very local level through different structures such as digital innovation hubs, but not exclusively. Important to say that we are currently in the design phase of the Innovative Health Initiative, where the industry and the Commission are working hard together to design the different research and innovation which will be funded under this initiative. The budget of this initiative is quite important, and many opportunities are foreseen there for integrated care, for and for digital health in general, for digital skills in particular. Another important thing to say is the current creation of the Pact for Skills on digital skills in health, together with the industry. The call for this pact is currently open. And then other opportunities that come with deployment of solutions through through ERDF, through cohesion funds, and the projects and the initiatives that will be funded and supported with the Recovery and Resilience Facility and the plans that member states submit to the Commission, and as you know, with a very important budget as well. Lastly, I would like to draw your attention to some interesting publications that could be of interest to you in case you have not yet come across them, especially the Joint Research Center, JRC, published 3 interesting, so 2 reports, and the Atlas of Demography, which is an online platform showcasing demographic developments in different regions, and a report on the demographic landscape of EU territories and the health and long-term care workforce, and how migration and digital technology could contribute to it. As I said in the beginning, the aging report as well will be adopted in 2 days, so I am not quite sure that it is published yet, where projections for expenses are put down in healthcare, long-term care, and education until 2070.
Irina, sorry, you ran out of time, although everything is really interesting, but we don't have so much time today. Also, the part related on digital skills is very interesting for us. We are also involved in the Pact for Skills, but we will invite you for additional information. And thank you very much for this very much informative overview of the responses that you have received on the Green Paper on Aging. We are proud and happy having participated to the bunch of responses that you have received. And cherry picking from your presentation, I bring home 2 concepts: need to promote local solutions and develop age-friendly community. And this gives me the inspiration to present our last speaker for this first slot of the event, who is José Miguel Corres Abasolo from the Council of Vizcaya. He is the project coordinator of the EU-SHAFE Interreg Europe project. The title, I mean, the acronym EU-SHAFE means European Enabling Smart, Healthy, Age-Friendly Environments. And we started from the concept in writing this proposal of the World Health Organization, which says making cities and communities age-friendly is one of the most effective local policy approaches for responding to demographic change. José Miguel, the floor is yours, and thank you.
Hello, thanks, Natalia. Good morning, everyone. Well, as Natalia has said, I've been asked to make a presentation of our project, EUSAID project. It's Europe Enabling Smart, Healthy, Age-Friendly Environments. So deeply involved in the topic that we are discussing today. Well, I will try to convey to you the project we are working on, its rationale and its objectives. Well, the main statement, the statement of the World Health Organization is the central fact pursued by the project. When the World Health Organization says that making cities and communities age-friendly is one of the most effective local policy approaches for responding to democratic change, well, it's a clear...
José Miguel, yeah. Sorry. Can you put your screen in presentation modality?
Sorry, in which?
Presentation modality?
I think it was, sorry.
No, it's not.
No, what?
No?
I read here that we are sharing the screen.
Yes. You are sharing the screen, but it's not in presentation modality. So let me try to help you.
Is it now?
Yes, perfect.
Is it? Okay, sorry.
That's okay, no worries.
No, I cannot. But as I said, well, this is a clear definition, which in practice, however, has its nuances and comments, mainly from the point of view of the regions that it is in the field that in which the project is already working. When we talk about region in Europe, we find a wide variety of concepts that encompass them with all kinds of differences, geographical environments, administrative entities, some almost independent, some others just delegated, different sizes in terms of square meters, in population, density, and a lot of different factors. At the same time, the different regions are separated in Europe, one of the other, and unrelated to each other and with different approaches. So most of the times we do not meet each other and there is not a clear relationship. And at the same time, with respect to technology solutions, well, we are not always user-friendly for the end users, and we take an approach to this fact, a different approach from each region. So these are the three facts that we have faced in our project in a way. So how to deal with this? How to deal with this situation? Well, it's not a case of reinventing the wheel because, well, till now we can work together with aligning policies, with collaborative efforts, and sharing proven good practices, what has been put in practice by some others, and it has been successful. So not reinventing the wheel, but using tried and tested ways. Well, this is what we are doing from the strong consortium of 10 participants with 7 European regions, with the mentioned characteristics, very different characteristics I previously mentioned, large and small populations, urban and rural, rich and not so rich, with or without resources, that it is not always related to being rich or not. At the same time, we have two representatives of the academia, two prestigious academic institutions that develop their analytical work and methodologies. And we have the responsibility of communication and dissemination allocated in the organizer of this event, that is Alliance, which is responsible for publishing achievements of the work as a basic factor of the project. So, learning from others, sharing, and with the fruit of this learning and adaptation to the different environments or new applications to develop policies to integrate them. Then we include administrations, academia, private firms, NGOs. The fruit of this regions participated are concentrated in the corresponding action plans, which are contained in the existing, quantificable and measurable, which is including the respective operational plans of the region in the European Regional Development Fund framework. The development of the project, affected in a very important way by the current health situation, has had problems, of course, like all of us, but in this case, in which the exchange, the visiting situ, the meetings to other users, organizers, is a basic element. It has affected us more severely, more in depth. However, like the rest of the European citizens, we have developed our work using technology communication, improving in each practice and each meeting. We are obtaining better and better results. As always, keeping in mind those face-to-face meetings, which we all miss. And of course, we hope to return as soon as possible, something that in any case it would be very, very good for all of us. We have been working on 40 best practices, have been assessed, analyzed, discussed the two first domains. We are currently working in the third, and we are having a meeting next week in Slovenia. And well, this is all I can tell you in order to make a presentation of this project, that it is, of course, working in the topics of the aging and in the green paper environment. So I hope that I have given an accurate picture of our projects, which my colleagues present in this event, like Natalia and Claudia, will clarify and improve in the next presentations. So thank you from my side.
Thank you very much, Jose Miguel. And yes, you gave a very nice overview of our project. And now let's start with the second part of this discussion. So I leave the floor to Karolina Majkiewicz that will moderate it. She will use the Mentimeter, which is an interactive tool to really involve the public in participating and giving opinion. So thank you to all the speakers of the first part. Karolina, the floor is yours. Thank you very much.
Thank you very much to all our speakers that set the scene, told us why we are here today, what we are doing, and introduce us to this topic of the healthy aging or smart of healthy aging and the role of the new technologies in ensuring the healthy and smart aging in the future. And I would like to ask now our audience, maybe you can either open this on your screens or on your telephones and go to menti.com, put the code 54272231, and tell us if you yourself or your organization responded to the consultation to the green paper on aging. Okay, we are getting some responses. So again, menti.com 54272231, and please go there because we will use this. There will be some more questions, and I will now post this in the chat. So let me just do this. And so menti.com. All right, and we will go to the next question. I see that I have a bit of problem here with the Menti. So let me just come back. Apologies for this.
I think, Carolina, if you press C, you can unlock the voting.
Apologies for this. C. No. Okay. I unlock the voting. Nevertheless, let me just move to the next question, which is also problematic. So I don't know really why this happens. And thank you for being with me. And the second question, what comes to your mind when you think about the new technologies for smart and healthy aging? So you can put your thoughts. What comes to your mind when you think about the new technologies for smart and healthy aging? So as a bridge to our second part, when we will hear from the representatives of the projects about their response to the green paper on aging, and the frame of this event is the role of the new technologies for smart and healthy aging. And we're getting some responses. So great chance, independency, protection, mobile devices. All right, we also have love. So new technologies, new chances, helpful. That's fantastic to hear. So with this, I will stop the Mentimeter. Thank you for your votes. You still can add to those questions. And I would like to invite Claudia Fernandez Rivera from the Technological University of Dublin, representing the EU-SHAFE project. Claudia will open the second part of this event, where we speak, when, as I mentioned, we will hear from the 4 representatives of the projects that responded to the Green Paper on Aging, and hear the overview of what they suggested to the European Commission, what they suggested in the response that then Irina earlier presented to us in a more consolidated way. So Claudia, the floor is yours.
Thanks, Carolina. Thanks for the invitation. Also, I was delighted to see the first part of this webinar, because it shows that we are on the same wavelength. So I'm really excited about that. So now I'm going to start. Let me know if you can see my screen.
Yes, we do.
Oh, perfect. Okay. So, well, hello again. I am Claudia Fernandez, a researcher in the EU Smart, Healthy, Age-Friendly Environments project. And yes, on April, we submitted a response to the EU Green Paper on Aging. For doing so, we participated on an interactive virtual co-creation workshop using Mentimeter as well, so that every participant had their voice heard. So these results come from the voices of these organizations that are part of EU-SHAFE, and Jose Miguel has already mentioned the organizations, but here they are. This participatory horizontal approach is important because this spirit permeates throughout the whole document. So we gathered 256 answers to all the questions, and this is a summary analyzed through the lens of the role of new technologies in keeping older people at work and good health. In reality, our document talks more about the role of older people in the design and implementations of these new technologies. This is what our shared experiences and learning from the good practices in our partner regions have taught us. So this is one of our suggestions: listening to older people's voices, considering their different contexts and aiming at inclusion. The EU Green Paper on Aging acknowledges the great potential of new technologies for sustainable healthcare. Another suggestion from EU-SHAFE was to support projects that showcase these technologies so that citizens can familiarize themselves and have better understanding of how they can avail of the benefits of technology on a daily basis. Here we can see an example of a good practice that does precisely that. This one is Dogs in Aarhus, and another one is Hands-on SHAFE. And both, well, actually people from Hands-on SHAFE are in this call, and both good practices tackle the fear of technology, and at the same time, they enable the silver economy. Another suggestion was simple language for all public services and information. For example, with pension schemes. When we were discussing this topic, we agreed pension schemes were a complicated one. And here we were talking about age-friendly experts, but also European citizens acknowledging the complexity of pension schemes. We have to consider that not everyone has the same level of literacy, and this factor is related to income. So new technologies can help to communicate with other people more effectively, regardless of their education or social status, by translating the message to simple language in whichever media it is distributed, so that everyone understands how their pension schemes work. And also, what about sign language? New technologies could help filling this gap on digital inclusion. There are ongoing research projects about simple language automated translation. So user-friendly and inclusive communication on all public information opens the path, not only for an optimal retirement scenario, but to better health literacy, and why not, eco-friendly aging in place that reduces energy poverty by explaining how energy grants work. In our project regions like Laos and Hamburg, there are best practices that already provide information in simple language, but technology can make it widespread and so accessible and easy that it becomes mandatory. So this one is a good practice in Hamburg. It's a health kiosk that provides healthcare information in simple language. We propose to consider social participation as an enabler for good health, because studies show that social participation can reverse older people's physical decline. So digital civic engagement as a form of social participation combined with citizen science could be a path to include older people in the creation of public systems, products, and environments. During these circumstances, we experienced how technology played a crucial role in communicating with our loved ones or be invisible to them. So digital literacy was key. Of course, training is mandatory, but we can make the learning curve smoother and more inclusive if we involve other people on the creation of technologies. An example of participatory approach is this good practice in Friendly Cities for All in Vizcaya. Here is the website, ciudadesamigables.com, which is a project in which citizens provide feedback to make basically accessibility mapping on an urban scale. Volunteering has played a big role in helping us fight these hard times, especially for all the adults. The EU Green Paper mentions that about 1/5 of 65 to 74-year-olds participate in formal volunteering, while people aged 75 plus also remain engaged when their health allows. Our suggestion was to take a closer look into volunteer strategies. For example, having a well-established digital volunteering database that records volunteer activities, quantifies effort in hours, and allows them to apply for further opportunities can help us identify which are the jobs that older adults choose and create more ad hoc policies, contract facilities, etc., that allows this socially engaged human resources to stay in the workforce for a longer period, of course, considering GDPR. Then again, our partner regions, in this case, it was Slovenia, have examples of these practices that could be replicated throughout Europe and enhanced with digitalization. Lastly, we took a look at what's guiding how we perceive and measure healthy aging, and this led us to the Active Aging Index. Our suggestion here is to reconsider some of the factors that make social participation. And here you can see this one factor is a bit controversial, taking care to children and grandchildren. While partners in our regions, like Age-Friendly Ireland, are fighting to empower older adults and telling them that it is okay not to be able or do not want to take care of their grandchildren, including this into active aging is a bit contradictory and could be problematic if we use this to create policy. I mean, there are some regions in which it's cultural, but all that we are saying is that it is not meant to be an expectation for older adults. As well, it has to be mentioned that it doesn't measure older people's leisure activities. Maybe if we had a better knowledge of that, gap on the silver economy could be filled. The extended lifespan is a reality and it's happening. So let's create an environment where it is a healthier, happier, affordable, better quality of life, greater dignity and fun. Finally, following the Europe Digital Agenda, isn't now the best time to start also measuring older people's digital participation? And for this, to close this presentation, I want to ask an honest question, just out of curiosity. Irina also said like a preliminary to this question, but since this consultation was a digital conclusion, a digital consultation, how many older adults that are struggling to keep themselves in good health and want to remain in the workforce participated directly on this public consultation? How many people do you know? Was the request in a format that they could use on their own? The role of new technologies could be precisely to widen that avenue. Maybe make it next time more than 133. I don't know. What about 1,000? So that was it. Thank you for your time and attention. I would love to hear from you as I'm doing research on digital public services and inclusion. So here is my LinkedIn and my email address. And that was it. Thank you very much.
Perfect. Thank you so much, Claudia. Maybe you want to also post in the chat the link to your LinkedIn and your email address to make it easier to find you. And thank you so much for presenting those recommendations from the EU Chauffeur project to for the consultancy of the Green Paper on Aging, and also highlighting some of the opportunities. I really like your last comment, or this quote about widening the avenues, and earlier we heard from Jose Miguel about also closing the gap. So thank you so much. And with this, I would like now to invite Charis Vasiliou from Byte company in Greece, coordinator of the SmartWork project. So SmartWork is co-organizer of this event together with the EU Chauffeur, and SmartWork works on developing AI-powered solution to empower older people to stay longer at work and in better health. And Charis, we know that SmartWork replied together with actually 4 other projects of the same profile to the Green Paper on Aging, and you can tell us what SmartWork had to say to the Commission. You can start sharing your screen.
Great. Thank you very much, Carolina, for this introduction, and of course for the invitation. I'll just start sharing my screen. I'm hoping that everybody can see this presentation now. It has been a really interesting start at the beginning. I was very interested to see the outcomes and the work that's been done on the Portuguese side, and of course very interested with the presentation and the feedback on the statistics from Irina, because here also in Greece we share some of these elements regarding public consultation. It's really a big struggle, and the questions also posed by Claudia are also quite interesting, and it's really fun to see how different diverse opinions they are in terms of the consultation. I can see some of the opinions that are similar, and of course we're looking at similar things such as digital skills, for instance, and some other quite diverse elements. So thank you for giving me the opportunity to discuss some things with you today. You gave a brief overview about SmartWork. Of course, we are focusing mostly on innovative technologies. We are using artificial intelligence primarily to build a system, a group of services which are focused on the worker in terms of trying to integrate unobtrusive sensing, modeling the behavior of the worker, the elderly person, and providing innovative services towards their end as well as the end of the employer. So here's just a very brief overview of some of the very basic SmartWork services that we have, focusing on all different directions. We have the part about the actual office worker, the elderly person, a different set of services that will help them on a daily basis, monitoring their health, measuring the psychophysical capacity, provide on-demand training, which is a key element of continuous education, as well as supportive services for the employer and the carer. Now, looking at the Green Paper, I'm not going to go into detail about the Green Paper per se, but just focus a little bit on what we as SmartWork presented on key elements. First of all, it is a process that we follow to have a questionnaire as well as focus groups that we derived some of the comments, which we then integrated and focused on these 5 major key aspects. So the first one is about the fact that we need technologies to be designed in such a way as to focus on the needs of the users of the elderly people and to take into account basically their skills and available resources. So this is critical point number 1. The second most important element that we found and we suggested is the fact that there is a problem about office workers re-entering the labor market because they are lacking in digital skills. And this is quite a critical point that we want to focus upon, because we need to have adequate technologies, specific training adapted to the needs and the way that the elderly can learn. Number 3 was the fact that we need to promote more, focus more on the positive aspect behind this longer working experience and about reskilling elderly people. Just do more in terms of promoting the positive elements behind this. We also need the industry to focus more, not only in producing technologies, but also in adapting these technologies on daily working environments, thus helping this specific workforce to produce better and have a better, healthy well-being as well in their working environment. And last but not least, on point number 5, we wanted to focus also on the fact that these deployed technologies should really take into account different socio-economic aspects. So looking at the first part, just focusing on just a few of these pointers, looking at the first part, we have on the part of the technology design, the fact that the senior user base is usually overlooked when we're talking about the new design and the new technologies, apps, and so forth. And that's really important, that we need to take usability into consideration based on different user personas that we have for elderly people. We should take into account demographic data, obviously, demographic information, but other elements that focus the design, such as their personalities, the different hobbies, what are their favorite online activities, the devices that they use, their needs, possible frustrations due to health-related issues, and obviously the end goals. So we need to focus on the fact that technology can change their lifestyle and also their behavior in the working environment, and identify the physical and mental differences that we have between the different stakeholders in the working environment between elderly and younger workforce personnel. And obviously, usability is number 1 critical point that we need to look into when talking about new technologies and applications for this particular target group. But my personal favorite and my personal focus is on digital skills. And it should come to no surprise that we have, for instance, around 77% of seniors that they really feel they need assistance to be able to figure this out. According to DAISY figures, we have 35% of these people that have just basic digital skills. So we need to invest on that. We mostly have interventions for elderly people that focus on how they use technology. But we need to focus, I think, more on how they understand online information, and why not create digital content on themselves. We need a framework for assessment of the digital skills and literacy of the elderly people. And the newly created Digital Education Hub needs to work also towards that direction. And why not use programs that we also have here in Greece and other European countries about having mobile education units, or utilizing the Help at Home program for this part. So we need to have benefits of a longer working experience and reskilling, new attitudes in the working environment, we need to transform the working environment into also a better learning experience as well. I think this would create a better support for these people. And last but not least, the silver economy, as was mentioned before, the longevity economy, it's quite a strong force that should be taken seriously into consideration, focusing on development and inclusion and defining very clear strategies. These are some of the outcomes that I wanted to mention about our participation in the Green Paper. And thank you very much for your attention. I'm open up for questions. Thank you very much.
Perfect. Thank you so much, Charis, for presenting what SmartWork is working on, and also presenting all different, not only the recommendations, but also the considerations, and reminding us that investing in the digital skills of older people is actually the key. Without that, we cannot move forward. As for the questions, I remind all our audience, please use the box Q&As on the bottom of your screen to ask the questions or put the comments, as we already received one comment there. And with this, I will then invite Karina Dantas from the Shine to Europe, coordinating Net for Age friendly cost action. Karina and her team also responded to the Green Paper on Aging, and I'm looking forward to hear what were your key recommendations, Karina. Well, maybe not your, but the consortium.
Of course, thank you, Carolina, for the introduction, and also thank you for the invitation and to allow us to share the outcomes of the broad participation we have regarding the Green Paper on Aging. I hope you are seeing my screen well.
Very well.
Okay, so I will try to make it quick because the main angle I understand is to discuss this further in the plenary as well. Overall, and just to give some framing, the Net for Age friendly and is based on the work that was developed by the stakeholders network, Smart Healthy Age Friendly Environments, the SHAFE network. And I'm doing this as the introduction just to say that for a number of years, and EU SHAFE is an outcome of this network as well. We have been working on different angles of the SHAFE concept, which means bringing together to the same discussion and to the same table ICT, health and care, citizens empowerment, and the building environment. So trying to put in the same agenda all of these areas, and probably most of the people here have already somehow heard about this, so I won't take it longer. But based on this, on 2018, we delivered the joint statement to the European Commission, and based from that, a number of different areas have been worked on to be implemented. Most of all, the main asset of SHAFE, I would say, is to try to understand things in context and to connect the different areas. So we do acknowledge that digital is the future and we need to take it as much as possible into the discussion, but this can only work if all the other areas of society are developed at the same time. And this is something we try to bring forward in all the discussions so that the policy decisions, the funding decisions can acknowledge this connection between the different areas. And of course, a lot of this has been discussed for many years, and this is also something we translated into the Green Paper on Aging. So we did one of the projects that has been implementing the stakeholders network on SHAFE is Net for Age friendly, which is the reason why I'm here today. So this network is supported by the COST program, and the main purpose of it is to try to advance on as much sharing of knowledge as possible. We have currently a network that is reaching 320 participants in 45 countries of the world, and not only Europe, which is very good because it gives us the opportunity of trying to understand what is working in different countries and how we can take it from ones to the others. And possibly the second asset of this network is that it's not only research oriented, usually cost actions are, but in this one, we made it very clear and as the grounding of the network that we would want the quadruple helix to be involved. So that means, of course, academics and scientists, but also business, public authorities and citizens. And the main aim is to putting all of them to work and talk together. So for some time, we have now almost still 4 years of the project, we will be discussing on how to establish local regional ecosystems that work on this implementation of health and well-being with ICT and the built environment. And this goes on with these 5 different working groups that are here being presented now. But now we need to understand how this was translated to the Green Paper on Aging, and I will go there directly. So we did well, not very long, but somehow long answer to the Green Paper, and I will only show some highlights. Of course, that life cycle approach that the Green Paper has and all the territorial aspects considered are very connected to the SHAPE concept. And I was very glad to heard by Irina and some of the answers that she showcased that a lot of the things that we advocated for were probably also advocated by others and are in some of the conclusions. So we extracted just some key points from the answer we provided. And of course, this goes into direct connection to what I was presenting regarding the SHAPE concept and the net for age friendly approach. So most of all, as a first answer to the public consultation, we propose and promote the creation of this local, regional, or national ecosystems that work together, including the citizens, including all the different stakeholders in trying to promote more inclusive environments. So this goes beyond health and care, of course. It goes also to all the other areas of life, and in this case, also to the working environments, which is one of the reasons why we are discussing this here. So for all of them, we hope that the different actors come together and try to discuss ways of improving healthy lifestyles, improving independent living, improving the indoor and outdoor spaces where we live, and of course, do it in an inclusive way. One of the areas that was highlighted in the Green Paper and well is the difficulties that we still face on promoting lifelong learning. And technology is possibly one of the main drivers why it is not possible anymore to just go to the university and end our learning at that time. There are still a lot of difficulties in putting the trainings in place, in guaranteeing that people get to enhance their skills as needed. So, of course, one of the areas that we see that possibly needs to be enhanced is on trying to target the solutions that we have, try to adapt them to the different realities. And for this, the grassroots organizations in all of the different countries are very important because they are the ones that know the context and they are the ones that can facilitate this at the end. I think this is also very much in line with the EU SHAPE proposals and the way the project is developed. Of course, that for this, coaching and guidance are somehow more effective than training as in the traditional way, and capacity building for the different organizations is also very important to be able to promote this lifelong learning. In terms of the labor market, and this is possibly the area that interests most for this discussion. Some of the things I think Kari's already addressed as well, and I think we are not uncovering the holy grail, but indeed we need to start reshaping the labor market into a more flexible way. We proposed job coaching for lifelong learning, trying to change the general mandatory retirement ages, giving possibilities to decide on working at home or online instead of not necessarily at the office, and provide resilience and mental training. This is, if we do this in a combination, we do believe that it will be possible for older workers to stay longer at work with good health and with good quality of life, because these two things should be put together, not just keeping longer at work, but being able to do it with a good quality of life. Of course, people in different ages also need sometimes different time schedules, they have different habits, they can work in different ways. So maybe we need to indeed find ways of having the work being adjusted to the people's possibilities and not necessarily the opposite. And of course, we consider this would promote mutual learning between different generations, which is so important, as we know. Almost at the end, one of the areas that also connects to the working environment, and that can be maybe an opportunity coming out of the pandemic, is the connection between the silver economy and the development of rural areas. With all of the changes that we have in the world in the last year and a half, a lot of people would like to leave the cities and go to rural places. And this can be an opportunity for job creation. It can also improve our touristic offer in different countries. But for this, we need to improve the infrastructures in these areas. And maybe with this, we can enhance the promotion of more remote working. And this would possibly be a win-win situation in many different perspectives. To end, we would propose that the environments as a whole would be adaptable and personalized. This is very much in line with the SmartWork project as well, to the different needs of people as they age. This is for sure one of the assets that we can propose that can change the way we face work and life, and for sure will enhance also the community participation. As I said, this was a very brief summary of all the proposals that we did, but I hope it's enough to foster the discussion. And again, thank you for the invitation.
Thank you so much, Karina, for this overview, very, very rich response to the different parts of the Green Paper indeed. And with this, I would like to hand our virtual microphone to the Joan Martin from Louth County Council and President of the EU Convent on Demographic Change. Joan, we would like to hear your thoughts on the topic and some reflections. So please, the floor is yours. Please put your microphone and camera on, and we invite you to the stage. Jean, are you with us? We don't hear you, we don't see you with your presentation. I'm not sure what is happening now. I think we actually, did we lose? Is there my colleague who can confirm that it seems that we actually lost Jean at this moment? She's not with us. So with this, I will take over, and we already heard from people from Brussels, let's put it this way, about the big policy developments, what is going on there, and how actually our response can contribute to those developments. And I would like to invite you still, our audience, to share with us via Mentimeter, again, menti.com, and then please use this code 54272231. You can also find it in the chat area. Which recommendations would you like to highlight to the European Commission? So Irina from the DG Connect is still with us, and then we can share. And we already have some replies, so thank you so much for being active. Develop an effective mechanism to ensure implementation of policies and deployment of innovative solutions. Well, of course, that's very important to make things happen. Improvement in quality of life through age-friendly environments, and always ensure you listen to the voice of older people when designing policies and services that affect them. So those are the recommendations that you would like to highlight. Please don't be shy. Join us on the menti.com and share with us your thoughts. What kind of recommendations would you like to highlight to the European Commission? But I see that at this very moment we don't have more people joining us, so maybe I would like, taking the opportunity that we still have 10 minutes of the time, I would like to our guest speakers to maybe open their camera and join me here by the virtual table. And if we can maybe take, I see that the comment was from John that she cannot see any controls to turn on the video and sound.
That's okay, Carolina. I didn't seem to have come on the right way, and I had no ability to turn on a camera. I've come in again.
Now with us. Fantastic.
Fine. You can send them my presentation. It was amazing.
So please, if you are here with us, do you want to tell us what's your
No, well, I suppose the main thing that struck me, I suppose, coming at the green paper from the Covenant point of view, coming at it. No, you didn't bother. Don't worry about that. Coming at it from a Covenant point of view, I suppose I was mainly thinking about age-friendly communities and the WHO framework for age-friendly communities. And for me, I suppose over the years listening to the EU, I was always disappointed that older people were seen as it was the challenge of aging. It was the impact of aging on our health systems. It was always about the cost of aging, the cost of pensions and all of that. And it's nice to see that the Green Paper has a wider kind of an approach, and it talks about smart housing, and it talks about digital, and it talks about transportation and barrier-free smart transport and all of that. But I still feel there's a way to go from to seeing older people as and their full rights and their full their independence and their lives. And I think somebody earlier said we need to listen to older people, and we speak constantly about hearing the voice of older people. And I think that is the problem, that we develop policies and we develop services, and we don't talk to older people about whether it's what they want or how they need it or how they want it. And I also think that the EU has always undervalued the impact of age-friendly environments, and of having an environment and public spaces and systems that work with you as you get older. That the impact of that on your life, on your health, on your mental health, on your longevity is enormous and is very difficult to measure. And I think it's underestimated. And, you know, I'd like to see more value being put on just simple age-friendly environments that we would talk about in the Covenant, that the World Health Organization age-friendly cities and communities is based around, and allowing older people to age with dignity and the ability to continue to live full lives, and maybe never have to leave their own homes to do that. And I think we're moving along, but I still want to see more respect. It's maybe not the right word, but more direct interface with older people, and more thinking about what they need and not about what they cost. So I suppose that was my main takeaway from the Green Paper. Progress, but we have a way to go.
Perfect. Thank you so much. I think that this is very good highlight, and in one or another way also a good summary to those recommendations shared by the other project. And maybe with this, I would like to, well, we don't have that much time to go deeply into the different avenues and consider opportunities, benefits, risks. But I think what we heard today was a lot on the side of opportunities, to see the digitalization and to really see the digital solutions as a chance, as also someone responded in the word cloud, and giving the opportunities. And there is a lot of ideas in the community, in the SHAFE community, on how to really how to improve the situation of older people. But I would like to ask our guests and panelists, if you had to choose one key action that you would like to put forward, either within the community or you would like to see happen on the side of the European Commission, what would that be? What would be this priority, this one action you would like us to take right away? And Irina said, well, it's us, but it's policymakers, but I'm sure that there are also some people, engaged in policymaking also under our audience. So what would you suggest them to do? John, I see you have your microphone open.
Yeah,
so do you want
I think
one sentence from each of you.
I think addressing digital poverty and making sure that people are not left behind. If we're going digital, well, bring everybody along and do everything we have to do. Karina would have touched on some of the things there in her presentation, but we need to address digital poverty and make sure people aren't left behind.
Great. So by digital poverty, I'm sure you also mean access to the internet and to the digital solutions.
Access to equipment, access to broadband,
sure.
Access to knowledge and how to use it.
As we had also in our comments, there was a comment, of course, about the remote areas. And Charis, you have your hand up. And you're muted.
So you are correct. Sorry about that. Yeah, I would still vote for digital skills. I'm a big supporter of that initiative, both looking at here in Greece through the Ministry of Digital Governance and the effort that's been done there. I think it's a huge element, and also trying to reach people in rural areas as well through certain of these initiatives. So yeah, I think digital skills for me.
Thank you. And I will pass the microphone to Claudia. What's your recommendation for this priority area?
Yeah, I'm also in the digital team, but I would add accessibility and usability of these technologies, and engaging the real end users in the creation of these services and environments.
Thank you so much. And of course, we know that our projects and different digital solutions are being developed in this co-creation manner. So this is happening. But of course, we also have to put attention to making sure that those voices are being heard. And then I will ask Karina. Karina, what's your take on this?
Well, it's not a news, of course, but it would be very good to start seeing everything being defined, departing from the person and not from the different areas. So it would be good to redesign things to adapt to people and not force people to adapt to things. So a bit more than co-creation, it would be put all the things around that we need, but give us the possibility of doing in places, environments, tools that people really want to use and that are needed by them. Yeah.
Thank you. I see, Irina, that you're taking notes and also shaking your hands ahead. So would you like to comment? Is there something valuable still that you heard today that you would like?
I can only join all of the different recommendations and those to all the different aspects which are, in my opinion, equally important. In fact, the recommendation on finding an effective mechanism to deploy innovative solutions came from me. Why? Because I think this is the main challenge that we as policymakers of the Commission have. We know about the amount of great solutions that there are and that could be developed, and the importance of these policies and initiatives, and there is always a difficulty to make them grow and to make them see on the ground, to make this really happen on the ground. So I in a way hope that this could be facilitated in these coming years to also to make sure that these innovative solutions and ideas come to all citizens. So that would be from my side. Thank you.
Thank you, and of course we are all here to support you in this work. Just as a comment, we also had in the Q&A that the comment that age-friendly communities should be included along with the intergenerational connectivity. Otherwise, the ageism will be around, and of course that's also one very important area of action to tackle ageism. And just to close, I also saw that my co-moderator, Natalia Allegretti, had her hand raised. Natalia, would you like to comment or give us?
Yes, very, very quickly, and taking the opportunity of having Irina still with us. My accent today would be on humanity, I would say. Humanity for the older generation. Digital skills are essential, so I completely second what my colleagues said before, but we have also to put the older people in the condition to really enjoy and profit from the opportunities that going digital will bring to them, which means supporting them at local level, maybe with intergenerational actions. So young people supporting the older in really staying at home and enjoy what technology can bring to them. Just a little example, very, very quickly. I've been working with the European Commission a lot on e-prescriptions long time ago. And finally, it has been put in practice very quickly during the pandemic, which for me has been quite a success. But on the other side, I've got an old father that is receiving prescriptions on his computer, and he doesn't understand how to use them concretely. So humanity for me and support, really support, should be the voice of the governments in the next future. Thank you very much to all of you.
Thank you to Natalia. Thank you to all our guests on the speaker side and on the audience side. Please don't hesitate to follow the projects on our social media. You see the SmartWork EU and EU Chafé there in the bottom, and follow also developments of the age-friendly policy on the EU level. So with this, I would like to thank you all for taking time, for being with us, and wishing you a lovely, sunny and healthy day ahead. So thank you so much. And the virtual applause to all our guests.
Thank you, Carolina and Natalia, for such a great organization.
Yeah, thank you.
Thank you. And let me thank Federica Porco, who is always behind the scene, and she has been the organizational person for all this to be here and happen today. So thanks a lot, Federica, and see you soon again, all of you online, or hopefully in person. Have a good week. Bye-bye.
Thank you.
Bye-bye. Thank you. Bye.
Bye-bye.